So welcome everybody this afternoon to our workshop, which is on troubleshooting your voice prosthesis leakage. And a warm welcome to everyone who has joined. Hopefully this will be a really informative session and you'll take away lots of tips and tricks. And we really welcome your engagement as well. So if you do have any comments or questions, please pop them either into the Q&A or the chat function. Next slide, please, Claire. So just to introduce ourselves, my name is Faye Ramoset. I'm a speech therapist by background and I'm one of the clinical educators here at ATOS Medical. And I'm going to let Lacey introduce herself.
Hi, I'm Lacey. I'm the head and neck nurse for London and East Anglia. I recognise some names in here, so hello to you guys.
Fabulous, thank you. So Lacey and I are going to take you through today's webinar. So if we just go to the next slide, please.
Okay, so this is the disclaimer. This is a corporate presentation from ATOS Medical Group. Nothing in this presentation provides any diagnosis, clinical advice, indication, guide, warranty or guarantee. Nothing in this presentation can substitute individual advice or guidance from a qualified healthcare professional. Any testimonials relate to how one individual has experienced the use of ATOS products and not every person will get the same results. This event is being recorded. By joining this webinar, you are consenting to being recorded during the event. So today's agenda is going to cover what is a voice prosthesis, what causes your voice prosthesis to leak, how to check for leaks, the signs and the symptoms, and ongoing care tips. I'm going to hand over to Faye to start the first section.
Thank you. Fabulous. So before we get into what is a voice prosthesis, I'm just going to launch a poll. So it's really for us to get to know you guys in the audience. So let's have a little look at the first one. Here we go. So I don't know whether you can... check in the chat. Okay, so in the chat, you should see some polls. So there should be one that's how long have you had your voice prosthesis? So you should be able to submit your vote in there. And then there is another one, which is what type of voice prosthesis leakage have you experienced? And then there's a third one looking at how you clean your voice prosthesis. So if you can get into the chat and see those polls and submit your vote. Fabulous. So Rosamond has had her, you've had that for 7 years, your laryngectomy, is that correct? I think people are just going to type into the chat, which is absolutely fine.
So you can also access the polls via the polls section at the top of the screen.
Oh, there we go. Yeah, normally they pop up for people, so yeah.
I can just try and launch the instant poll if you want.
If you could, that would be great.
I'm not sure.
No, that's okay. Don't worry. How you guys are doing it is absolutely perfect. So we've got a wide range of different lengths of time that you've had your laryngectomy. So we've got from 7 years right down to just 4 months. So we've got a wide range of veterans and those who are a little bit newer. So Rosamond, thank you. Cleaning twice a day, twice or more a day. Okay, that's really helpful. How about leakage? So has anybody experienced central leakage, peripheral leakage, or both? If you can, oh wow, George, 30 years, 30 you are the veteran of the group. Okay, so Rosamond's experienced both central and peripheral. John, you've had central leakage. Tony's had peripheral, right, okay, both. And twice, David, you've had it twice. Okay. Central leakage most days. Okay.
Oh dear.
Fabulous. Well, not fabulous that you're experiencing the leakage, but fabulous that we maybe can get to understand a little bit about what causes some of the leakage and what this voice prosthesis actually does, and maybe some tips and tricks to try and get the best out of your voice prostheses. Okay, so if we, all right, Steve, yeah, when you swallow, you're finding that you get a little bit of leakage. Is that through the center of the valve? Or is it around the valve? Around the outside. Okay, interesting. Okay. Okay, Claire, if we can pop to the next slide. Feel free, guys, to keep popping any comments or questions in the chat as we go along. This is a session really for your benefit, so make the most out of quizzing us as much as you like. Hopefully we can either answer it or give some suggestions as to what potentially you can talk to your clinicians about. So if we look at what a voice prosthesis is, so this little device that you can see here, that is a voice prosthesis. Good point. Yes, John, you're quite right. The milk test doesn't work if you're holding your breath whilst doing it. Yeah. And we'll come on to the testing bit a little bit later on. So what is a voice prosthesis? It's a small plastic device and it has two flanges either side. One that when you shine a torch into your stoma, you'll be able to see. That's what we call the tracheal flange, the bit that we can see. And the other side of the flange is actually the esophageal side, which sits on the other side of that party wall. And they're designed to keep it really snugly in place. Between those two flanges, there's like a barrel or a small tube, and within that tube, there is a one-way valve. That valve only opens when you speak, and it closes when you should be eating and drinking or even breathing. So we want it to just open to allow airflow to go through it so that we can then vibrate that new segment within your esophagus, which then gives you a voice. So this is what it looks like. If we go to the next slide, we can have a little look in more detail as to what it entails. So what you will see is that the left-hand side of the picture, that is the bit that you will be able to see in your stoma. So you have that valve. You can see the angle of the flap, that closed one-way valve. So that will then open outwards to be able to allow the air to flow through. It's also got a little hood at the back when it sits in your esophagus, and that's an extra protection to stop any food particles going into the centre of that valve and causing it to leak. And obviously the inner diameter is quite wide, so it allows that airflow for really good speech. So that's some of the features and how it actually works. So that valve will stay closed whilst you're swallowing and breathing, and then as you block your stoma to redirect the air through your voice prosthesis, it will push open the flap and allow the air to travel up so that you can use it for voicing. Next slide, please. So what causes your voice prosthesis to leak? I think often this is a really helpful topic to go through, because I think sometimes understanding it helps us to be able to manage it a little bit better. So if we go to the next slide. So most of us will experience voice prosthesis leakage at some point, usually between sort of 2 and 4 months when the device lifetime has sort of come to the end. And what exactly do we need to look out for, and how can you manage those symptoms? So the most common reason for replacing your voice prosthesis is because of leakage. Normally that will be the reason why you would go to your clinicians for a voice prosthesis change. So don't be alarmed. It just means potentially that your device life of the voice prosthesis has come to the end and you need a new one. However, there are bacteria and yeasts that can naturally occur in our mouth, throat and/or food pipe, and these can cause the voice prosthesis to leak, along with some tissue-related problems with the puncture site. So how your puncture site's been created and what your tissue is like can also cause some leakage. Next slide, please. Okay, so if we look at the most common, it's central leakage. Okay, so that's where you will get fluid or food coming through the center of your voice prosthesis and falling into your airway. And there are three main reasons for this to happen. So the first one is where you have a mechanical obstruction. So all that means is as you're eating, some food particles can get underneath the flap that's in the tube of the barrel of the valve and wedge it open. And so what that means is when you continue to eat or drink, little bits can come through and they can fall into the airway. So that's one of the easiest ways to check whether it's a mechanical obstruction, is to just give it a quick clean. If the problem goes away, problem solved. The largest, probably most problematic way for getting central leakage is by a thrush or candida or biofilm buildup. Now, those naturally occurring bacteria and yeasts that we find in our throats and in our esophagus, they can actually sit on that flange of the voice prosthesis. And if it gets into the silicone, which is what the flanges are made of, and the flap is made of silicone, then it can actually start to degrade that property. And so that therefore you get the flap that becomes less effective. Now, when we talk about central leakage, we talk about early central leakage. So if you've had a valve change and then within a few weeks you're starting to leak centrally, when you remove the valve, your clinician should be able to have a little look and see whether there's any candida buildup. And once they know what the cause of the leakage is, then it's a little bit easier to troubleshoot. There is a small proportion of patients who will have a buildup of pressure when they're swallowing, or they may have a bit of a narrowing of their food pipe. And what that can do is create a little bit of pressure, which can suck open the flap to when you don't want it to open and allow for things to come through the center. And that negative pressure obviously is something that we'd need to tackle because that can be problematic. So those are the three main reasons why you would get central leakage. So if we just have a little look at the next slide. So in case you've never seen it, if you've never experienced it, what we've got here is a little example of what central leakage it looks like. So this particular person has had a drink of green liquid, and what you will see is that green liquid as they swallow then coming through the centre of that valve. So it's just a nice way of seeing what's happening.
Swallow.
So as you can see, obviously there is an issue with the flap and the valve itself, and we've got quite a bit of central leakage coming through the middle of that valve. So we really need to try and manage that as well as get to the underlying cause. So next slide, please. So we've looked at central leakage and what the causes can be. So if we have a think about peripheral leakage, so peripheral leakage is where you get leakage around the tube or the barrel of the voice prosthesis behind the flange, and that can then drip into the chest. And there are a couple of reasons why this can happen. So it can either be device related or it can be due to the tract. The device-related issue is solely if the voice prosthesis length is too big or too short. Okay, so if when you look at your voice prosthesis, you can see some of the blue barrel, that might be an indicator that potentially your valve is a little bit too long. We like it to sit really snugly, and that's why potentially you will have your party wall measured to make sure you've got the right length voice prosthesis. But we do know that our length of the voice prosthesis can change over time. So it might be that you experience a little bit of swelling, in which case you need a longer valve. It might be that you lose a little bit of weight and therefore you need a smaller valve, and that can fluctuate over time. So it's not uncommon to have a change in the size of your valve. Some people might have the same length for years and years and years. Others might need it changing quite frequently, depending on their tissue. If you have a voice prosthesis that's either too long or too short, if it's too long, what can sometimes happen as you're swallowing is that it can piston in the tract. And so when it's moving backwards and forwards, it then allows for some residue to come around the barrel of the valve. It's not related to the diameter of your voice prosthesis. So depending on how wide that that tube is. That's not related to peripheral leakage, but the length is. The majority of people, though, will experience puncture-related issues. And so what they'll have is a voice prosthesis in place, and then the tract around the voice prosthesis might get a little bit wider, and that can allow for things to leak through. If that is the case, this is related to the tissue. And so it's really important that you work with your clinicians to find out the underlying cause of that enlargement. Sometimes there might be suggestions of trying a different valve or a troubleshooting valve, and that's absolutely fine. That will be something that you can discuss with your clinicians. But no matter what solution you find for peripheral leakage, it's important to get to the underlying cause. Otherwise, it will just be a persistent problem. So some things that can impact on an enlarged puncture are things like if you have an infection within that area. It can sometimes be the puncture shape. So that, again, that's how the puncture was made perhaps initially, or maybe it's changed shape. And so therefore, if you have a round tube of the voice prosthesis and the shape isn't completely round, then it allows for leakage to come through. Reflux can also be a bit problematic and cause some changes to the tissue, along with obviously the radiotherapy that you guys may have experienced. That can also impact on your tissue. If you're not able to eat and drink appropriately and you're a little bit underweight, perhaps a little bit malnourished, that can also factor into the tissue viability. Thyroid, diabetes, again, those are all factors that can deal with sort of tissue healing and how your tissue reacts to having something there. And then obviously, goodness forbid, but if there's ever a recurrence or any other further cancer, then that can also cause some enlargement to that puncture site. As with the central leakage, if there is a buildup of pressure in that esophageal or food pipe area, that can also, again, cause a little bit of pressure to push some food or fluid around that barrel. So again, if you've got a narrowing of your esophagus, that can make a buildup of pressure, or if you've got to use excess pressure to swallow, again, that can sometimes cause a little bit of what we call peripheral leakage. But let's have a look at the next slide, which shows a video of what peripheral leakage looks like. Now, it's a little bit trickier to see on this video. So what you will see is as this person swallows, the flange that you can see will become a little bit darker behind it as the water fills up. So just there. Okay, so depending on what you're drinking at home, if you're looking at your stoma, it can be quite tricky to see. If you're drinking something like water or not a coloured fluid, then it's going to be quite difficult to know whether it's secretions or is it the actual liquid that you're drinking. So if we just play that one more time, Claire, just so that everybody can, now that they know what they're looking for, can spot it. So again, you'll just see it getting darker there and the water filling up behind. Okay. So at least you know what it is that you're looking for. So next slide, please. Okay, so I'm going to hand over to Lacey now, who's going to take you through how to check for those signs and symptoms.
Okay, so yeah, this next section is going to be looking at how to check for leaks and what to do about them. So could we have the next slide? Thank you. So as we have already looked at, voice prosthesis leakage is when the fluid leaks from either around the outside of the flange or straight through the middle of the barrel. That is what we call central or peripheral leaks. So leakage from the voice prosthesis is normal. It can be from all of the reasons that Faye has already identified, bacteria and yeasts that will gradually stick to the voice prosthesis and over time can lead to leakage. Most people will experience this at some point, and the average life expectancy for a valve is about 2 to 4 months. So it is really important that you keep an eye on this, and you know how to identify these leaks if they happen. Next slide, please. So signs that something could be going wrong with your voice prosthesis. So if you see any fluid around your voice prosthesis itself, or coming straight through the middle of it, if you're coughing when you're trying to have something to eat or drink, any food or fluid stained mucus. So if you're suddenly you drinking a can of Coke and you realize that your secretions or you're coughing up a lot of dark coloured mucus, that would be unusual, and we would expect that that's probably a leakage issue. An increase in the amount of secretions that you deal with as well. So if you've gone from very well managed secretions to all of a sudden dealing with a lot of secretions, I think first port of call would be making sure that that voice prosthesis was not leaking. And if you're suffering from recurrent chest infections, so not quite getting on top of things, it could be that you've got a bit of a slow leak going on in your voice prosthesis, and it is definitely worthwhile checking that. Next slide, please. So I'm hoping that most of you will know how to do a leak test. This kind of gives us the overview of how to do things. So we would recommend that you stand in front of a mirror with a really good light, and you give your voice prosthesis a good clean. When you have cleaned your voice prosthesis, you then take a sip of something coloured. So we often use milk, and this is often referred to as the milk test, but you can use anything with a colour that is going to be clearly identifiable. So you don't want something that's red. You don't want anything that's going to look like the wall of your trachea. Look to see if anything's leaked from around the outside or through the centre of your voice prosthesis. And if you're unsure, ask someone else to check for you. Sometimes that's a little easier to get someone else to check. This flow chart goes through exactly how to check. So clean the voice prosthesis, as I said, repeat the swallow test. If there's a leakage, then your options would be, if it's a leak through the center, then you would usually be advised to plug your voice prosthesis and definitely contact your SLT or your clinician, whoever usually changes your valves. If there's a leak around the outside, sometimes that can be a little bit more tricky to manage. So again, you'd contact your clinician, get an appointment. You may be given thickeners to use, or you might be giving different advice regarding that. If you're not sure, but you've got all of the symptoms, then again, you might want to insert the Provox plug and try and repeat the swallow test again then. So if you're not sure if it's a leakage from around the outside or through the middle, you can then determine whether or not it's a leakage at all, or if it's just from around the outside. So leakage around the outside, you will definitely contact your clinician. But if it's still leaking when you've got the plug in, then you can remove the plug, because we know that it wasn't a leak through the center, and you have got a peripheral leak, a leak around the outside. If there's no leakage, then after you've put the plug in, then we know that it was probably a central leakage. So definitely use that plug until you've managed to go and see your clinician. And the next slide, please. So looking after your voice prosthesis. Yep, next slide. So a lot of my patients have some really great tips of things that they've learned along the way. So please, if you've got any good tips, feel free to put those in the chat as well. So with a voice prosthesis leakage, if you detect a voice prosthesis leakage, you shouldn't drink liquids by themselves. You can try and have sort of foods with higher water contents, like jellies and fruits, that will give you the fluid that you need, but are obviously not going to come through where you've got your leak. definitely, as I've said, you need to contact your clinician at the earliest opportunity to make sure that you can get in and get those leaks checked and probably get the valve changed. It's always important to know the size and the type of voice prosthesis you have. Ideally, these will be recorded in your notes, and you will have a clear understanding of what size they are. If you are noticing that you've got a lot of movement of your voice prosthesis, and particularly if you're sort of noticing when you're brushing that it's spinning fully in the tract, then just make sure that your voice prosthesis is repositioned correctly. So as we heard from Faye, is that the Vega valves have got a slight sort of overhang on the esophageal side, so the food pipe side, and it works best when it's up the right way. So you want to have the little tab that's cut when it's first put in, that ideally needs to be at the bottom, so that then the flap is over the top. So it's always good to check that that's in the right position if you are getting a lot of spinning when you're brushing. And again, if you're getting a lot of spinning, it could be that we need to resize anyway, and I would speak to your clinician about that. So if you've got most of my patients have a chat open with their SLTs, which is fantastic for the nice, easy talks about these sorts of things. Okay, next slide, please. So it's really, really important that you keep on top of your cleaning. We recommend that clean your voice prosthesis at least twice a day, and ideally after each meal. And that's because, as Faye has already told us, it can be very simple to get a bit of debris caught in the chamber of the voice prosthesis, and then that will keep the flap from closing fully, and that's what's going to cause your issues with leaks. Always make sure that you've got your voice prosthesis plug and that you know how to use it. And if you're not sure how to use it, then make sure that you do take it with you to your next appointment with your SLTs, and then they can show you how that fits, because that's going to be the thing that allows you to carry on eating and drinking, because invariably these problems happen on a Friday night or Saturday morning, and you've got the weekend to deal with this before your clinicians are back on Monday. Always practice using the plug so that you become comfortable with using it. And again, if you've not done this before, it's great to have, to use your opportunity when you see your SLTs to do this. But these are it is very, very simple to put in, and you'll use the back of your Provox brush to put this in. So you've got a little indent on the back of your Provox brush that will then help you to guide your plug in. Always talk to your clinician about a backup plan in case you do need to start using the plug. So how are you going to manage? What do you need to do? And again, a plan regarding a peripheral leak as well is really important. Next slide, please. Okay, so this is what the Provox plug or the Vega plug looks like. So these are used temporarily. We certainly don't want any long-term use of these plugs. This is just purely to get you through until we can change your valve, or we can get you in to see the clinicians and help work out what's going on. So the benefits of it is it allows you to continue eating and drinking, which is the main thing. Obviously, whilst this is inserted, this means that you can't talk, and that's the downside of it. It's inserted into the opening of the voice prosthesis with the help of the non-bristled end of the Provox brush, and then the medallion side, so the bit on the right-hand side of this picture, can be taped to the side of your neck. And I would always just recommend that you just change the location of that each time, so that you're not pulling it too tight, you're not changing, you're not causing any skin damage, anything like that. So we have to just be conscious of the potential for that sort of thing to happen around the outside as well. Next slide, please. So we've got a video here about how to use the Provox plug. You might not have seen this one before, but it's quite useful.
Good morning, everyone. I'm here today to demonstrate how to install a plug in your prosthesis once it starts leaking. In case y'all haven't seen one before, this is what it looks like. It comes with the plug. It took me a couple of times to learn how to do this to begin with, so don't get frustrated the first time. You put it on the end of the brush like this, not the end with the bristles, and you hold it tight with one hand like this. And once I pull out my hands free and put this in, I won't be able to talk. So I'll let you know now, once I finish installing it, I'm going to tape the tab to my chest. That way it won't come off. And after you do this, you can drink whatever you want to drink, eat, until you can have your prosthesis change. Here we go.
He's a pro at that. That was really, really good. And as you can see, nice and straightforward. So it's nothing to worry about, but it is something that is always a good idea, just to have a clear idea about how it all fits together. I think we're going to go straight into another video now. Yep.
Daily cleaning of the voice prosthesis or valve is important as it can help delay leakage and also remove debris from the esophageal end. You should clean the valve at least twice a day, and I recommend also after every meal. Cleaning it after you eat helps to remove any food debris that might get stuck on the esophageal end of the voice prosthesis. I'll just demonstrate now how to clean with the brush. So the Provox brush has a rounded tip and bristles, and you gently insert the brush into the middle of the valve, push it in until it stops, gently turn, and then remove. There are lots of different brushes for voice prostheses. Be sure to choose the right brush that goes with your voice prosthesis and also the right length. Remember that after you brush your voice prosthesis, you should also use the flush. I like to say it's like flossing. After you brush your teeth, you should also floss your teeth to remove any extra debris that's left over. In order to use the flush, put it into a glass of drinking water, squeeze the bulb firmly to draw water up into it, let go, ensure that you filled the bulb completely. After you filled the flush with water, place it inside the voice prosthesis until it stops, then flush the water through.
Okay, so this is the Provox brush. I believe that many of you will probably have the Vega valve in. So obviously there are different styles of brush, but this is the one that we're going to be talking about today. So we would definitely recommend this. So the following when you're using your brush. So gently move the brush backwards and forwards whilst rotating the brush, and that will help you to just clean off any of the debris that may have built up. This is designed with a rounded tip so that it will prevent accidental injury, and it's got the added safety wings so that there's no risk of or there's reduced risk of inhalation. It is flexible, so it's quite handy to get to awkward placed valves, and it's got quite a short handle, so hopefully that makes it quite user friendly. I've certainly found it quite user friendly. And obviously the bit on the end is the bit that helps secure the Provox plug. Now I can see that Tony's had some issues with securing his plug in his valve. So one of the tricks that I would say is just to make sure that you have got your valve fully on the end of your Provox brush, and you've got quite a good firm seal there. And you should feel, if it's the correct size, you should feel that it will almost want to, it will almost sort of give as you place the plug inside. So it will feel like it is fully secure. If you're not achieving that, then I would suggest that you take your plug in with you to your clinicians at your next appointment and just get them to try and secure it to make sure that you don't need a new plug, or there isn't any other issue going on there. Next slide, please. I'm not sure how many of you have used the Provox flush before, but this is another option, and it's really, really great for flushing after brushing. So this can help get rid of some of the more stubborn debris that is just stuck there and you can't quite get rid of with brushing. You can use this for air or drinking water, and you just make sure that you've got your flush fully inside the valve, and then push through. So we have got studies that show that by using the flush after brushing, it can help prolong device life. So that's always quite a positive thing. Okay, next slide, please. So always have a look at your brush first. I think probably like a toothbrush, like some of us are not as quick to replace the toothbrush than other people. So just make sure that your brush looks the way it should do. So you don't want to have bristles going in every direction. You don't want it definitely doesn't want to be dirty or anything like that. So you have got, you should always have enough brushes. If you're finding that you're using more brushes than you had anticipate, it may be that you might have issues with biofilm buildup, and in which case you can always try and request some more. You must always make sure that the brush is intact and that there's no issues with it before you start using that. So first of all, we advise you to wet the brush with clean water and then shake off any excess and make sure that it's not dripping wet. It should only be moist. Then insert the brush into the middle of the voice prosthesis and move the brush backwards and forwards gently, very gently a few times. You should twist whilst you do this and pull back if you feel any resistance. With regards to the flushes, you can't request this yourself, but we can speak to your clinicians. So if that is something that you want, then whoever does your normal order can speak to your clinicians to try and get you one. Next slide, please. So yeah, twist the brush backwards and forwards a few times while moving it back. Twist the brush. I tend to do a little twizzle as I'm cleaning a voice prosthesis and then move backwards and forwards. Do not rotate the brush if you've bent it to access a difficult stoma. So that's just a key point. So obviously as we touched on, the Provox brushes are very flexible, and we can completely bend the top of the brush so that we can get into an awkwardly placed stoma or voice prosthesis. If you've had to bend it, then you can't do a 360 twizzle because otherwise it's going to pull on the tract. So if you have done that, then just be conscious that you can only move backwards and forwards. Remove the brush and clean it thoroughly once it is out, and then dry the brush. Don't leave it in water. And as in the picture, it's a really great idea just to draw all of the water and the damp away from the bristles. Standing it up like you would a toothbrush is really good. And don't leave it in your pocket. If you could have the next slide, please. So how to use the Provox flush. So as I've said, you need to start by brushing the voice prosthesis and give that a really good clean. After you've used the brush, then you can use your flush. So you take, you place the tip in some water, squeeze the bulb and let it fully fill up with water. If you need to put some more in, then again, you can squeeze like you would a pipette. Place the tip of the flush in the middle of the voice prosthesis and ensure that it's completely flat. So it got a flat surface on the end of the flush that will allow it to completely marry up to the flat surface of the voice prosthesis. So it must always make sure that you've got a good seal there. And then next slide, please. And then you can squeeze the bulb and squirt the water straight through the middle of the valve. Release the bulb so it inflates with air, and you should have a completely empty flush at that point, and then remove the flush. And that just stops any leaks from happening, obviously it down into your trachea where we don't want the water. Next slide, please. So when you should seek help from your clinician. So if your voice prosthesis was dislodged from its position, definitely that you need to get into hospital straight away. If there's blood or fresh tissue in the brush when you're cleaning your voice prosthesis, again, definitely I would be alerting your clinicians that same day and asking for a review. If there's any tissue growing over your voice prosthesis, again, this could be signs that potentially your voice prosthesis might be looking a little bit short, so it needs to be remeasured and replaced. And if there's a leakage through or around the valve, again, this is what we've covered here, so it's definitely important that your clinician can review you and get that looked at. Next slide, please. So who to contact? You have got your customer care team, who you should have a named customer care agent, or Best Start nurse if you are still under the Best Start programme. You do have access to the nursing team, so if you do feel that you would benefit from a nursing visit, you can ask your customer care team or your Best Start nurse for a home nursing visit. We don't cover every area in the country, but most areas are covered. And you've got access to the My Life online events as well to help answer some of your questions and concerns. I have seen that there are a few questions in here. I don't know if Faye, you want to help with some of these?
Absolutely. Claire, if we're okay to just drop the slideshow, and then we can have a little bit of a discussion with some of the comments that have come up in the chat. So a couple of people, Tony in particular, has also mentioned that you find it quite difficult to insert the plug. Hopefully the video should show a little bit clearer how that should be done. It is key to use the opposite end of the brush, and also it's handy if you can really make the safety strap quite tight against the whole brush and hold on to it. It just helps to secure it a little bit better, because sometimes if you have the safety strap just sort of dangling, it can come off the end and then it doesn't fit in perfectly. When you're putting in the plug, it should almost click into place. So you should feel it nice and secure, and then when you release the brush, it should stay where it is. A bit like the guy in the video, it does take a little bit of practice, If you've got a track that's not as visible and is a little bit more tricky to see, then you're going to have to practice a little bit more. But once you've got it, then you'll know what that feels like and what it sounds like when you've got it in place. It's definitely something that if you next see your clinician, get them to go through it with you so that they can make sure, A, that you've got the right plug for the right valve, and also that you're inserting it correctly. So they can absolutely give you some support with that. So, and if you do have access to our ATOS care nurses and they're due to visit, they are more than happy to run through that with you as well. I think there was another comment about, do you recommend Nutrilist to try and seal the leak? And somebody else, John, has also been given a thickener to put with drinks if you have a leak. Again, it depends on the leak. Yeah, there's no harm in thickening your fluids. That's definitely not going to cause any problems. Depending on how much leakage you've got will depend on how much you may need to thicken your fluids. So if you're having tiny, tiny bits coming through, thickening your fluids will be absolutely fine. If you've had quite a significant enlargement of your tract, then you might be able to thicken the fluids, but you still might get a little bit of leakage. So there's no harm in having either naturally thick fluids, so anything with a milk base like milkshakes and yogurts and things like that, that is a naturally sort of thick substance, and that can prevent it coming through very small gaps. So yeah, a thickener is an option. When you're doing your fluid test, or testing to see if you've got a leak, if you do it with something like a milk, and I know that often this is what we recommend as speech therapists, is to do the milk test, but if you've only got tiny little gaps, milk is naturally thicker, so it may not come through and you might not see it and think that you're okay, but then when you go and have a drink of juice, you might have a little bit of leakage. So I always suggest try with the milk first. If that doesn't come through, but you still think there may be a leak, then what you can try then is with a coloured fluid. So it might be that you get a little bottle of green dye like we saw in the video, add it to a little bit of your drink, and then try that and just check for any very thin fluid leaks. So just a little tip there to be able to make sure that you're not missing something, because sometimes those thicker fluids can mask an underlying problem. It's also not uncommon to have leakage and you not be aware of it. Particularly after radiotherapy, sometimes the sensation can alter, and so you can have quite significant leakage and not be aware of it. And as Lacey absolutely mentioned, usually you might get increase in your mucus and you might get recurrent chest infections, and that might be the first sign that you've got a bit of a leak. And it might be that you've been doing the milk test and it's been passing perfectly, but if you try it with a thinner liquid, you might then notice that that's been the underlying cause. So just a couple of things to look out for. Just having a little look down here. Okay, so Steve, you're having difficulties with the direction of your valve, and that's not uncommon, unfortunately. Sometimes the direction when the valve is placed is okay, and then as you heal, it can go off on a bit of a tangent, but it's sounding like yours is quite vertical, and obviously they've suggested that there's not much they can do without sort of letting it close up and repuncturing. But yeah, as Lacey said again, we can bend the tips of these brushes, which you've already identified that you can do, so 90 degrees. But again, the difficulty with that is you just can't use the rotatory motion. But for somebody like yourself, what might be helpful is adding in a flush. So if you can't get a really good clean with the brush, at least you can use it to loosen the debris, and then maybe rather than using water, you can perhaps just use air. Pop it in and just give it a squeeze and it should push any residue through. So that might help with some of the cleaning, especially for those valves that are on a bit of a tricky angle. In answer to John's question about can you use the Provox brush in your Blomsinger valve, each valve comes with its own brush designed for that valve. So your Blom comes with a white brush, and it's designed so that it doesn't go all the way through the center of the barrel of the voice prosthesis, because the flap it won't withstand it being pulled back through. So if you were to use a Provox brush with your Blom valve, what you might find is that you damage the valve flap, because the length of the bristles is a lot longer on the Provox brush. So we do say that it's definitely better to stick with the right brush for the right valve. That absolutely is what we would recommend. Having said that, I have seen lots of people doing all sorts of very strange things, and I did have to pinch some mascara tips off a patient who was using that to pop through his valve and clean it. So you are all very inventive. I'm not gonna deny that. But my advice would be definitely use the right brush for the right valve, because they are designed to fit not only in diameter so that it fits the whole space and cleans it properly, but also the length of the brush as well. So it's important to do that. Temperature of drink makes a lot of difference. Yeah, ice cold is normally okay. Okay, is that in terms of you don't tend to leak with ice cold? And that's quite common, because if you think about the difference between heat and cold, what you'll find is obviously the heat will soften the tissue, and it makes it sort of exposes some of those vessels, and so therefore you might find that with the colder liquids, it sort of tightens around the valve. And so therefore you might find that you don't get as much leakage with that, whereas with the warmer liquids, everything starts to relax a little bit, and therefore you might get a little bit more leakage through. So that does make a little bit of sense to me. And I suppose it's really, if you really enjoy a cup of tea, that could be a little bit problematic. Again, I would be asking where it's coming through. Is it coming through the center, or is it coming around? I would assume if it's to do with the temperature, that it's potentially around it. But I could be totally wrong. Yeah, peripherally. Yeah, so that makes sense. So yeah, your colder ice cold drinks are going to be definitely better, because it helps to tighten everything around that valve. Okay, so George, you're having a routine change after 6 months without any leakage. So that's yeah, and there's lots of different practice throughout the UK. What you will find is, as you talk amongst yourselves, you will notice that your clinicians do lots of different things, and it doesn't mean that one is right, one is wrong. It just means that it's very, very different clinical practice. So some places will allow you to keep that valve in for as long as it's working, and the idea is if it isn't broken, don't fix it. And other places want to keep on top of that, and so they will do a change regardless of any problems after a period of time. So again, it's just horses for courses really up and down the UK. So you will definitely find that practice will vary, and when you talk amongst yourselves, you will also notice that your clinicians will do things differently, and it'll depend whether you have your valves changed by a nurse or by a speech therapist or by both together. Again, all of those approaches bring something new to the table. So that's, I mean, the fact that you're getting 6 months is really good out of a standard valve, so well done. I use an endoscope plugged into my mobile as my eyes. Yes. Okay. Brilliant. Very. You see, this is what I mean about you all being engineers. I don't know how that happens, but you are so inventive. It's unbelievable. So coffee leaks in every swallow peripherally. Yeah. And again, it could be down to the temperature. There are a couple of troubleshooting valves that are available widely, but again, that might be depending on how often you're leaking. Your clinician might discuss that with you. So sometimes there are valves with extra flanges that sit in the esophagus that help to prevent it. There's also the little sort of polo mint washers that can go over the front flange. So, you know, there's a lot of different options for both peripheral and central leakage, and you can certainly discuss those with your clinicians to see what's appropriate for you. They absolutely know your tissue the best, as like you do, and so they'll be able to guide you in what will be the best sort of troubleshooting valve, if any. So Bob's also changed to ice cold, and that's definitely helped. So that's a note to those people who are struggling. So the ice cold obviously can help everything to contract, and that can help reduce it. And anybody who's interested, the endoscope that can be attached to the mobile so that you can actually see a little bit better, they're about £10 on eBay. So little sideline business going on there, Steve. Fabulous. Wonderful. I think we have covered most of the comments or questions in the chat. Okay, so Brian, you mentioned that you found that you unfortunately have thrush, and it seems that the valve doesn't fit correctly. Thrush is a real bind. It's something that's naturally occurring. It's what we all have. The difficulty that you guys will experience with a total laryngectomy is that because the swallow mechanism will change after surgery, you do have a lot of time for whatever you're eating or drinking to pass through the esophagus into the stomach. So it does sit for quite some time within the food pipe. What that means for you guys is that it's got more places that it can just sit and build up. And so, you know, it is an ongoing problem for patients who've had a total laryngectomy, that they do suffer with increased levels of candida. Now, that can either be in the mouth, or it could just be in the throat, or it could be both. Now, there are a number of different ways of trying to treat thrush. Obviously, if it's impacting on your voice prosthesis and you're having to have regular changes, then that can obviously cause a little bit of an issue, because then that means you're having to go frequently for appointments. Again, there are troubleshooting valves that are available that you can discuss with your clinicians that might give you a longer period of time with your valve. So again, always advise you to go back to your clinicians, because like I say, they will have worked with you and know what your tissue's like and whether some of these more difficult troubleshooting valves are suitable. So by all means, have those open discussions with your clinicians about maybe alternatives if it's getting too much. But I think in terms of thrush, obviously, most commonly, most people will try something like nystatin, and you can have that orally as well as topically through on your tip of your brush. And that's usually where most GPs will start, with a bit of a regime of having some oral medication as well as topical. And then when the oral is finished, then you can continue with a little bit of topical treatment as well. So again, talk to your clinicians. This is not going to be new information for them, and if they don't know, they will be able to find out. And obviously you've got ATOS care nurses that are a really good support resource for you guys. And you know, obviously you can reach out to your clinicians, can reach out to us in the clinical education team as well if they need any support.
I think
so. I'm hoping. Sorry, go on. Yeah, go for it.
Would just be, if you are using nystatin on your brush, I'd have a brush that you only use for nystatin, and then have a separate brush as well that you're going to use to do your regular cleaning, just because they don't tend to last too long when you start putting nystatin through them, so you want to have that one separate.
Fab, great tip, absolutely. So hopefully that has at least uncovered some of the mystery around leakage. Hopefully you've taken away some great tips and tricks, not only from the stuff that we've presented, but also from each other, because you've got some great stuff in the chat that's really helpful. And obviously, if you have any further difficulties, do reach out to your clinicians, do touch base with your best star, or sorry, can you swallow nystatin? Yes. Oh, yeah. Did you want to respond to that one?
No.
Yeah.
No,
yeah.
I think the answer is just yes, isn't it?
Yes. Yes. Yeah. So there's different methods that it comes in, but there is an oral nystatin that you can get. So yeah, you can use it orally and topically through the brush. So, but please do reach out to your clinicians, do reach out to your best star or your nurses, and do reach out to your customer care reps if you need anything at all. We're always here to help, and hopefully we will see you for the next webinar. Thank you very much.
Take care. Thanks, guys.